First of all, thank you to Heart of England NHS Trust. I'm absolutely delighted to be here at this really, really excellent event. My name's Pete Mercer, and I'm Head of Public Sector Membership Programmes at Stonewall. What does that mean? It means I lead on our strategy, working with health sector organisations, public sector organisations right across the country, and I lead on our public sector partnerships and manage the team that delivers that. To be clear from the outset, I'm quite new to this role. I've been in Stonewall 3.5 years, but this role in particular is quite new to me, and so I've been thinking a lot about where our priorities lie. And let me be clear, the health and social care sector is absolutely my number one priority, and hopefully I'll be able to convince you of why that is by the end of this presentation. I know that there's a totally diverse crowd in this audience, so obviously, this is related to health and NHS trusts, but I would encourage anybody from any kind of sector to think about some of the statistics I'm going to talk about. I would argue that if you're from an emergency service, for example, that you might need to think about some of these things in relation to prevention and reducing risk. If you work for a local authority, you obviously play a role in deciding local health priorities, so I'd say this is relevant. And if you're an employer, I think you need to be aware of some of the disadvantages that LGBT people face with respect to their health needs. It's fair to say that I've got a lot of slides, so apologies to Sally and thanks for bearing with me. And also I've got an inability to edit down, classic me. So, so what's going to happen is I'm just going to run through these slides, great presentation style, so I've heard. So I hope you can keep up. It is going to be a bit intense and slide heavy, so please strap in and do bear with me. So I work for Stonewall, as I've said, and our vision at Stonewall is to create a world where everyone, everywhere, is free to be themselves, whether it can be accepted without exception. And these are our 4 strategic priorities that we think we need to do in order to achieve that vision. Stonewall's been around for the best part of 30 years now. It was established by a number of notable figures like Lisa Pinney, and as illustrated here, say Ian McKellen, nearly 30 years ago in response to Section 28, a really pernicious piece of legislation, part of the Local Government Act, which said that basically same-sex relationships were invalid and not real, and anybody who was caught talking about this in schools and local authorities could lose their jobs. So that is where Stonewall has come from as an organisation, just part of a really rich history of LGBT movement in the UK. And in terms of the work that we've helped to achieve so far, we've seen a lot of legislative change, specifically relating to sexual orientation, that we've kind of been a part of. So I think, you know, we've heard from Anthony about equal marriage and how that was quite important for him and his partner, and that's the case for many, although not all, LGB people. And I think it really meant that a lot of people started to question, you know, have we achieved everything now? Should we just pack up and go home as a charity in Stonewall? But we know that that's absolutely not the case, because it's one thing to change legislation. It's quite another thing to change hearts and minds, and it's quite another thing to change culture, as demonstrated by some of the public responses to our most notable campaign, Some People Are Gay, Get Over It. Here we've got Some People Are Straight, Get Over It. Thanks for that, I wasn't aware. Most people are gay, get over it. Not gay, ex-gay, post-gay, and proud. Get over it, alluding to conversion therapy. Gay feelings can change. Again, another nod to conversion therapy, which is not allowed by British medical standards, or certainly not endorsed by the NHS. Some people are gay, get over it. Lol gays, perhaps a millennial response. And then some people are gay, get over it. Kill them on the more extreme end. Obviously, these bottom 2 being less organisational responses, more individual vigilantes, clearly taking it upon themselves. And if that doesn't convince you that there is a lot of work to be done, and I should clarify that I'm speaking at the moment about sexual orientation specifically, and not gender identity, though I will come to cover that in some detail later. I've got some more stats for you. So 2.4 million people of working age have witnessed verbal homophobic bullying in the workplace in the last 5 years. 800,000 staff have witnessed physical homophobic bullying. The number of LGB people who have experienced a hate crime or incident in the last year because of their sexual orientation has risen by 78% in the last 5 years. And you might say that that's because more people feel comfortable reporting, but we've actually seen both an increase in reporting and an increase in net, and proportionally speaking, reporting hasn't actually gone up, which is really concerning. And nearly 1 in 4, and then looking across the globe, 76 countries worldwide have laws against LGBT people, in some cases making it punishable by death. And then nearly 1 in 4 LGBT people have tried to take their own life at some point. That's young people specifically, and that figure rises to nearly 1 in 2 of young trans people. So some pretty stark statistics there that I hope set a bit of context to convince you all, if you weren't already, that our work clearly is not yet done. So if we look at health and sexual orientation specifically first, I just want to do a very, very quick exercise. Just for about 1 minute, I want you to turn to the person next to you, and I want you to talk about what you either did last weekend, or if nothing eventful happened, or it feels like it was too distant a memory, something that's going to happen this weekend. What are your plans for the coming weekend, perhaps? Except I don't want you to use any gendered words. I don't want you to use any names. Gendered words include he, she, him, her, wife, husband, boyfriend, girlfriend, auntie, uncle, etc., and so on and so on. And I want you to see how you get along just for the next minute or so. How does that sound? Everybody clear? Great, go. Okay, very quickly then, how did people find that? Awkward?
Easy for us.
Easy, if you're used to doing that?
We're old.
Anything else?
Normal.
Normal. Interesting. If you're not LGBT yourself, you know, how might that have felt? Was that difficult for anybody in the room?
Yeah, it was difficult. If you're not LGBT, it was difficult because you're used to referring to, so because it's so difficult.
Yeah.
To actually go into that almost neutral text.
Yeah. Lots of people find it quite exhausting to keep that up on a continual basis. It's quite distracting. But it also means that you're missing out on some quite crucial parts of your life, right? If you're LG or B and you're unable to talk about your partner in certain terms, you're not able to talk about certain things. So imagine hiding information about yourself that is critical to your health because you're concerned how your doctor might react to you being LGBT. Imagine your partner got ill and you couldn't visit your partner for fear of coming out, and you couldn't leave work. Imagine being in long-term or palliative care and not being able to have a picture of your partner by your bedside or have that partner visit, right? So when you start to think about it in certain contexts, it becomes clear why that can be a challenge for lots of people, for lots of LG and B people specifically. So in terms of LGBT health inequalities, we know that health needs have been considered by healthcare professionals very rarely, actually, historically, and if they have, it's been in terms of sexual health. Women are often assumed to have no specific needs at all. LGBT people have many of the same health needs as anyone else, but they also have some unique healthcare concerns. And I'll come on to those in a second. LGBT people experience poorer health in key areas including sexual health, mental health, and some particular cancers. Targeted work with LGBT people can help reduce the health inequalities they face, and that's really important to remember. Why is there a high prevalence of priority health issues among LGBT people? It is not the gender or the sexual orientation of a person itself, but the experience of social exclusion. That's something very important. At no point do we want to pathologise LGBT identities. That's not the thing. It's rather about social treatment, by and large. Looking at health inequalities of lesbian and bisexual women specifically, we know from our research that 66% smoke compared to 50% of women generally. We know that they're more likely to drink alcohol at least 3 times a week, 5 times more likely to take drugs, statistic that really shocks me. Less than 50% are screened for STIs, 20% have deliberately harmed themselves, and are more likely to experience discrimination from pregnancy and fertility services. With gay and bisexual men, 2/3 of gay and bi men have smoked at some time in their life compared to half of men in general. 25% currently smoke compared to 22% of men in general. 42% of gay and bisexual men drink alcohol for three or more days a week compared to 35% in general. And 50% of gay and bisexual men have taken drugs in the last year compared to just 1 in 8 men in general. Almost 90% of gay and bisexual men have never discussed heart disease with a healthcare professional. 80% have never discussed high blood pressure or high cholesterol. 25% of gay and bi men have never been tested for any STIs, which I still find absolutely shocking. 30% of gay and bi men have never had an HIV test, in spite of early diagnosis now being a public health priority. And a third of gay and bi men who have accessed healthcare services in the last year have had a negative experience relating to their sexual orientation, a third. Then if we look at age as a variable as well, 56 of young LGB people specifically have harmed themselves, which can include cutting or burning themselves. 23% have tried to take their own life at some point. They are 4 times more likely than their heterosexual counterparts to suffer major depression, and 3 times more likely than their heterosexual counterparts to be assessed with generalized anxiety disorder. In comparison with heterosexual young women, lesbian and bisexual women are almost 10 times more likely to smoke at least weekly and twice as likely to have consumed alcohol in the past month. Young gay and bisexual men are more likely to use recreational drugs, and as few as 13% of young people in general have disclosed their sexual orientation to their healthcare provider, as few as 13%. And considering all of these health inequalities, that's really shocking and something that we need to address clearly. Then with older LGB people specifically, getting older obviously can be more complex for LGBs. They're more likely to experience the prospect of perhaps living alone or without much personal support. LGBT people are more anxious across a range of issues, including future care needs, independence, mobility, and broader health. And LGBT people are more likely to rely on formal support services as they get older. And we also know, and this is perhaps generational, but perhaps not, considering what we've just heard about young people, but many would not feel comfortable being out to health and social care staff. Older LGBT people are nearly twice as likely as their heterosexual peers to expect to rely on a range of external services. At the same time, 60% are not confident social care and support services would be able to understand and meet their needs. More than 40% are not confident mental health services would be able to understand and meet their needs. Nearly 50% would be uncomfortable about being out to care staff, and a third would be uncomfortable about using a housing provider, hospital staff, or paid carer. So now health and gender identity. We know that the NHS is systematically failing trans people, and I say that boldly, aware that there are many healthcare professionals, but this is a structural issue, and one that I know that many healthcare professionals are absolutely committed and determined to change. But we have to recognise that we have got a long way to go in this respect. Trans equality is obviously something that has perhaps become more prominent in the last few years, and there's been a real spotlight shone on perhaps some of these deficits. So at the bottom we see UK nurses lacking skills to treat transgender patients, researchers say. The RCN survey of nurses points to inadequate training, with only a fifth saying workforce has relevant training and experience. So examples of transphobia, very quickly, and these are things that we know happen across lots of different sectors on quite a common occurrence. Speculating about someone's gender, consistently referring to someone's trans history, questioning someone's ability to pass, purposely ignoring someone's preferred pronoun, inappropriate questioning of medical treatment, obviously if you're not a medical professional in that context in itself, disclosure of somebody's trans history, and exclusion from use of any facilities. And we know that this has a huge impact on trans people. So I've intentionally separated out gender identity from sexual orientation because I think the experiences are notably different. 75% of trans young people say they've experienced transphobic name calling at school, with 28% saying they've experienced physical abuse. And I talk about this because I want to shining light on perhaps where some mental health realities stem from. 62% of trans young people have thought about suicide, and 48% of young trans people have tried to take their own life, a statistic that I mentioned earlier, an absolutely shocking statistic. And 88% of trans people have at some point experienced depression, compared to 1 in 4 of the wider population. And pausing on that for a second, again, I reiterate the point about not pathologizing this. This is really about exclusion and treatment in society, and the impact and the effect that it has. We've just released a couple of new reports. This one just a couple of weeks ago. LGBT in Britain looks at the experiences of LGBT people in all walks of life. And we have produced a trans-specific report to really delve into those statistics. We know from this research, and it is really up to date, as I said just 2 weeks ago, so hot off the press, 2 in 5 trans people, 41%, said that healthcare staff lacked understanding of specific trans health needs when accessing general healthcare services in the last year. Almost half of trans people who want to undergo some form of medical intervention but have yet to have it say that long waiting times prevent them from accessing that. And 3 in 5 trans people who have undergone or currently undergoing medical intervention are unsatisfied with the time it took to get an appointment. So when I say that the NHS is currently failing trans people, I think we've got a sound evidence base for that. And I know that it's something that the NHS is keen to address. We also know that 1 in 4 fear discrimination from a healthcare service provider, and the same percentage of trans people. 7% of trans people say they've been refused care because they are LGBT while trying to access healthcare services in the last year. And more than 1 in 10 trans people have gone abroad for medical treatment to alter their physical appearance, including buying hormones over the internet from other countries. A further of 17% of trans people are considering this, and that's presumably because they cannot access this in the UK. And here are just some of the quotes from this research as well. So we have found that the NHS is letting down trans people with too much evidence of an approach that can be said to be discriminatory and in breach of the Equality Act. And this is actually from a government report in 2006, actually, from the Women's and Equalities Committee. Trans people face significant difficulties when accessing general NHS services. There is a lack of understanding and lack of cultural competency around trans issues in the NHS. And we received significant evidence of the toll taken in poor mental health, self-harming and suicide attempts by untreated gender dysphoria. And these are all direct quotes that you can lift from the government's own inquiry into trans equality. I would also encourage you to think about multiple identities as well. So obviously our sexual orientation or gender identity is just one part, of us and what makes us us. And so it's also important to think about the ways in which other parts of your identity can intersect and overlap. So, consider how the experience of an LGBT people might be shaped differently if they have another protected characteristic. So, for example, the social exclusion that might be a result of someone being LGBT and being disabled. Health inequalities of an LGBT person exacerbated because of their BME and therefore less likely to be given prescription medication, for example. That's statistically true. And how might religiously or culturally motivated rejection from families affect a young LGBT person, for example, and their health needs. Very finally, I'm aware I've only got a few minutes left. As I said, I am a crammer. A couple of years ago, we did a piece of research called Unhealthy Attitudes, which looked at the experiences of health and social care professionals themselves, right? It was a huge survey that we did with YouGov, and 62% of responders were people who had direct responsibility for patient care. The findings were very worrying and spanned 5 areas: bullying and discrimination, failure to support LGBT patients, fear of speaking up, failure to challenge prejudice, and supporting LGBT equality broadly in a broader sense. Now, I'm not going to go through the whole report. You can find it on our website, Unhealthy Attitudes on Stonewall, and I'd encourage you to have a look, but maybe don't look at it when you're feeling fragile, because it is not a nice read, I warn you. But some key stats: a quarter of staff, LGB staff specifically, said that they've personally experienced bullying or poor treatment from colleagues in the last 5 years as a result of their sexual orientation. 1 in 6 patient-facing staff said they'd not feel confident challenging colleagues who make negative remarks about LGBT people towards patients or service users. A quarter of staff have never received any equality and diversity training, and those who have reported that the training did not include important issues in caring for LGBT patients and service users. A quarter are not confident in their ability to respond to the specific care needs of trans patients and service users specifically. And 1 in 10 have witnessed staff in their workplace expressing the belief that someone can be cured of being LG or B. So those are healthcare professionals. Now, trigger warning, these are not nice quotes to read, but they are realities. These are quotes from people who felt brazen enough to respond to an LGBT survey with anti-LGBT responses. My workplace would not support me in this. They let aggressive... sorry, I'll read this one first. I was told... Sorry, these are responses from LGBT people themselves. Rewind. So these are some really, really worrying experiences that we've uncovered. So my workplace would not support me in this. They let aggressive and abusive behaviour by family members go by all the time. I was told I should be hanging from a tree by a nurse from Nigeria with strong religious beliefs. People refused to drink from a mug I'd used in case I had AIDS. My volunteer worker who was a lesbian, I had a volunteer working who was a lesbian. She was outed by another member of staff to a group of young people who attacked her on the way home. And then this happens on a daily occurrence, and I'm not even going to read out some of these quotes because they're just horrific. And then we had some people who expressed homophobic, biphobic and transphobic attitudes and felt brazen enough to declare these with their name and their region in an LGBT survey. And I have to say some of these responses were worse than we really imagined. Somebody's sex is determined by his, apparently women and non-binary doesn't exist, his chromosomes, XX equals female, XY equals male, and this cannot be changed. Being transgender, I think, is mainly a mental condition. Again, nodding to pathology of identities. People are not born homosexual or lesbian, it's their choice. The word of God, the Holy Bible states clearly this is a sin, so does the Jewish Torah and the Islamic Quran. So, and sorry, I don't know why that kept propped up last, but simply Craig, from an administrator from the east of England, said trans people messed up. So some absolutely horrendous attitudes coming out. And I think we start to really get to the bottom of this when we ask questions around whether practitioners actually think that this is relevant. Sexual orientation and gender identity is even relevant to healthcare. So we know that 72% of care workers don't consider sexual orientation, for example, to be relevant to somebody's health needs. And I know the NHS is really keen in taking everything into account and assessing the whole person, and everything about that person is important, but that isn't necessarily filtering down to the front line. Even nurses, 62%, so getting on for 2/3 of nurses in our survey didn't understand why somebody's sexual orientation might be relevant to their health needs. Here we've got a couple of anecdotes. LGBT people should be treated exactly the same as other patients. Their sexuality is a matter for them, not for me. On the other hand, we've got somebody who's more enlightened. We're talking about a whole person, so everything concerning the person is relevant. Finally, I just want to go back to that quote about the belief that, about practitioners who have overheard somebody expressing the belief, a fellow practitioner, that somebody can be cured of being LG or B. That was actually higher in the West Midlands, so the national average was 10%. In London, it's a whopping 22%, so we definitely need to shine a spotlight there. But in the West Midlands came after London in terms of the orders, with 12% higher than the national average. Ultimately, we believe that all of this means that people aren't able to live their lives freely. So our mantra is people perform better when they can be themselves from a workplace point of view, but this goes beyond the workplace. This is about transforming the day-to-day lived experiences of LGBT people and their healthcare needs and their healthcare experiences being absolutely critical to that. We run the Diversity Champions programme, which works with about 80 NHS providers currently in the country, about 750 employers across all sectors and industries. So we're trying our best to change some of these realities. I would love to speak to anybody in the room who isn't working with us yet, but would like to. And finally, I just want to say a very quick word about our top political priority at the moment. Many of you will be aware or heard rumours that the government is considering reviewing the Gender Recognition Act of 2004. We think this is an opportunity. They've committed themselves to this, but how this is done is an absolutely other question altogether. Now, this is something that we think will be consulted on, we think, later in 2018, probably late spring. Ultimately, the Gender Recognition Act in 2004, whilst important at the time, still means that for somebody to change their legal gender is still a highly bureaucratic, unnecessary, in some cases really demeaning and overly medicalised process. So we want to strip it back and make it much more easier for people to change their gender legally. This is our top political campaigning priority right now, and we want to make sure it's done in the best possible way. We're also aware that there's been an increase in backlash in the media, including in social media, against the trans community. I think you'd have to live under a rock to have missed that. Most of the British print media has been guilty of it in some respect or another. So we think it's really important that alongside legal change, that we also do something to try to turn the tide against these narratives and turn narratives of fear-mongering into one of hope and change. So we're encouraging everybody that we work with to, in whatever ways they want to, come out for trans equality, and that might be organising events in your local community. It might be putting out statements on social media in favour of trans equality, or it might be simple but powerful actions that you can do in your workplace to support your trans colleagues in this time. So, definitely ran over, but only by a little bit. Sorry, Sally. And if anybody wants to speak to me about any of this, please do so over lunch. Thank you.